Hi, my name's Andy. I am going to be performing the administering oxygen skill today. I've been given a scenario that says I need to apply oxygen at 2 liters by nasal cannula. I've looked at my patient's information. I have my protocol here with me, and I've gathered all my necessary supplies. So now it's time to go see the patient. Hi, Mary. My name's Andy. I'm going to be your nurse today. I'm going to provide privacy and wash my hands and put on some gloves. Can you tell me your name and date of birth? Mary Smith, XXXXX, that looks right. And can you tell me if you have any allergies to any medicine? Okay, that's right. It looks like you're allergic to penicillin, iodine, ink, and sulfa. Thank you for that. How are you feeling today, Mary? Oh, I'm sorry to hear you're feeling a little short of breath. Let me raise the head of your bed. I'll put you in a high Fowler's position. Hopefully that'll help you feel like you're breathing a little bit easier. Does that feel a little bit better? Okay, I'd like to do a quick respiratory assessment as well to see how you're doing. So I'm going to do some vital signs and do a pulse oximetry. So I'll put this on your finger here. And then if it's okay with you, I'd like to put my stethoscope on your chest and listen to your heart and listen to your breathing. Is that okay? Okay, so let me do this. Just going to put my stethoscope right here on your chest. And you can just breathe like normal. I'm going to listen to your heart first. So I'm going to simulate that time has gone by. Mary, it does seem like you're breathing a little bit fast. Your respiratory rate's about 22, and your heart rate's a little bit fast as well. It's about 105. Also, your oxygen saturations are a little bit low. It's only 91%. I'm also going to do some other targeted assessment. I'm going to look at accessory muscle use, look for nasal flaring, intercostal retractions. I'm going to look for signs of cyanosis and mucous membranes. I'm going to look at capillary refill. I'm going to ask the patient how she's feeling, if she's feeling short of breath or restless at all. So Mary, I'm going to go ahead and put some oxygen on. I'm going to put it on at 2 liters by nasal cannula. And because it can be a little irritating to your nose and mucous membranes, I'm going to go ahead and put humidification with it. So to prepare my humidification, I'm going to make sure that I'm using sterile water for inhalation. And I'm going to fill my humidification bottle in between the minimum fill line and the maximum fill line. So I'll go ahead and add water to that level in between those 2 lines. And I'm going to go ahead and take the Christmas tree off the flow meter so I can attach my humidification bottle. I'll put the Christmas tree where I can easily find it again later, and then attach my humidification bottle. I'm going to turn on my flow meter and put it at 2 liters by nasal cannula because that's what we've been told to do. I'll go ahead and attach my oxygen tubing to the flow meter. And I know my humidification is working because I can see bubbles coming out the tubing. And I know the air is flowing through the oxygen tubing as well. So now I'm going to apply it onto my patient. Mary, I'm going to make sure these nasal prongs go down so that's not as irritating for your nose. And these are going to go inside each of your nostrils. I'm going to loop this tubing up around your ears and then lift this up so it's secure but not too tight. How does that feel, Mary? Does that feel comfortable enough? I can add some padding to your ears if you'd like. Okay, we'll just leave it like that. So now I'm going to simulate a little bit of time has gone by, and then I want to reassess Mary using the same assessment criteria I used before to see if the intervention was effective. Mary, are you still feeling short of breath the way that you were before? You're feeling a little bit better. That's good to hear. Is it okay if I listen to you breathing and listen to your heart rate again? Okay, so I'm going to put this stethoscope on your chest again here and listen. You just breathe like normal. So now I'm simulating time has gone by. So her respiratory rate is about 20 right now. And her heart rate is about 95, so that's a little bit better. I'm checking your oxygen saturations. It looks like your oxygen saturations are a little bit better at 94%. I don't see any signs of cyanosis. Your capillary refill is good. I'm not seeing any retractions or nasal flaring. The patient's reporting that she's feeling less short of breath than she was before, so this intervention has been effective. All right, Mary, I think I'm going to leave you for a little bit right now while I go document, but I'll come back and check on you in a little while. Are you feeling comfortable in the bed right now where you are? Okay, great. I just want to make sure your bed is low and locked and secure. I'm going to put your side rails down for patient safety. I'm going to make sure that you have your call light here so you can call me if you need anything. Do you have any questions or concerns before I go? No questions or concerns? Okay, great. So I'm going to remove my gloves and dispose of these. And I'll disinfect my hands. And now I'll go document my care.